What's your position on that? And even as we still remain on matters to do with healthcare, SHA is not working.
SHA is not working.
What is Gachagua's solution
SHA
to SHA?
is not working because it was a fraud. William Ruto attended a church service where I attended in Embu. It was the inauguration of the Bishop of Embu Diocese. And then he took the microphone to say SHA is working. He could not speak, he was shouted down because it's a lie. SHA is not working and everybody knows it. Even a 34-child knows SHA is not working. SHA was a fraud to steal money by Ruto and his cohorts. And already 104 billion shillings have been stolen. The NHIF system was working and it needed 800 million to be upgraded into something that is functional. The whole scheme of SHA was to steal funds.
Yet, Mr. Gachagua, you allowed it to happen with your deputy president.
I'm saying I oppose these things. And that is why when I was removed from office, one of the accusations against me, one of the grounds of removing from office is that I was not respecting the president and I was having insubordination by opposing government programs. But I oppose theft. I did not oppose a government program. I opposed theft by William Ruto and his people. So, you remember the other day, 10 billion shillings was stolen and paid to hospitals that are closely associated with CS Aden Duale. You remember on the 1st of December, Aden Duale, with a lot of drama and theatrics, gave a lot of documents to the director of criminal investigation, DCI, 1st of September. Today is, I don't know, 8th or 9th. Since that time, 3 months, nobody has been taken to court, nobody has been arrested, there has been no information. It was just drama and theatrics. Nobody will be taken to court. The whole SHA nonsense is theft of public resources by Ruto, Duale and company at the expense of the lives of the people of Kenya. That is the folly of it. You know, and they keep on sending ministers to tell Wananchi that SHA is working. People just look at them. You know, people just look at them. Every day. Yesterday I was in Muranga, in a place called Ithanga, for a funeral. And a matter was brought to my attention. A lady died 4 months back. She remains unburied because they are not able to pay the hospital bill for 450,000. They have raised 300,000. They are unable to raise 150,000 for the last 2 months. I had to give them 150,000 so that that patient, the body can be removed from hospital. And then you are telling us SHA is working. If SHA is working, that lady myself, if given an opportunity by the people of Kenya, there are certain things that I want to do. One, I would like to revert to the NHIF ideology. It was a very good thing. Just reform it well, upgrade it to meet the modern times. You know, again, Linda Mama, that was here, that was brought by Uhuru Kenyatta. We want our women to give birth with dignity. It was scrapped. I would reinstate Linda Mama. I would also like to work very closely with the private healthcare providers and the faith-based organizations, the church, the Catholic Church. They have beautiful hospitals, mission hospitals. The PCA Church, they have beautiful hospitals. We need to support the church. You know, like now, since NHIF was scrapped, they were owed billions of shillings. They have never been paid. Most of those hospitals owned by the church are almost collapsing. This is something that we must work on. Again, we must remunerate properly our healthcare providers. We must make sure that the doctors and the nurses and the clinical officers, they deal with human life. People who deal with human life are not your ordinary work. These are people who are dealing with life. These are people who need to be settled. They need to be well taken care of. And we need to have a discussion with them. We need also to expand the universal health coverage so that we make sure that the level 2 hospitals, that those are the dispensaries, and the level 3, the health centers, are properly equipped. You know, my brother, most of these cases that come to level 4 hospitals for admission and level 5, if there was proper intervention at level 1, 2, and 3, they will never get to the level 4. You know, but these cases get bigger because they don't get the proper attention. I would like to focus more on level 2. Those are the health centers, and level 3. The level 2 is dispensaries, level 3 are the health centers. I would like to focus more. And then again, the level 4, we make sure they are well equipped. And we will go a step further by making sure every level 4 hospital in the country has a ward
Recent reports indicate that former Deputy President Rigathi Gachagua has continued to voice strong criticism against the newly established Social Health Authority, SHA. In a series of interviews, he has described the SHA as a dysfunctional institution and a fraudulent project crafted by President William Ruto's administration to siphon public funds. Gachagua's allegations have been consistent and pointed. In one televised interview, he referred to the shift from the National Health Insurance Fund, NHIF, to the SHA as pure theft of public funds. According to him, the entire exercise was motivated by a lucrative Kenya shillings 104 billion tender linked to the new system. He further argued that the overhaul was unnecessary and excessively costly. Citing expert opinions, Gachagua claimed that upgrading and reforming the existing NHIF system would have required only about Kenya shillings 800 million. He questioned why the government chose to discard a system that, despite its flaws, was functional, only to replace it with one that costs more than 100 times the estimated upgrade budget. In his public addresses, Gachagua has gone as far as labeling the SHA a grand scam designed to enable the theft of billions from the Kenyan public. He alleged that the push for the new authority originated directly from President Ruto and a select group of advisors based at State House. Additionally, he condemned the rollout of the SHA as rushed and poorly executed. According to Gachagua, the system is currently not working, leaving many Kenyans unable to access essential healthcare services. He argued that the government should have taken more time to engage stakeholders and ensure that the system was fully functional before introducing it to the public.